Hey, this is Dr. Paul Baker with RenewStem, and I have Paul Kennedy here. And 3 months ago, Paul had his low back, his right hip, and his right knee injected. And just to preface the case a little bit, his right hip was, I've been practicing for 24 years now. His right hip had very, very severe degenerative changes. Probably one of the worst hips I've seen. And I actually told Paul, you probably have maybe a 20% chance of success. Didn't I say that, Paul?
Yes.
And we're going to hear his story on how he actually did with his hip and his with his hip and his knee. So, Paul, go ahead, take it away. Let's talk about how you felt before your injections for the hip and the knee.
Can I see me now? Anyway, yeah, the beforehand, after I had to go off anti-inflammatory, it was really, really, really painful. I was like, I don't know if I could do this. If this doesn't work, I don't know if I can make it 3 months. So it was really painful. I had really sharp pain in my hip and pain in my knee, really sharp, when I didn't want to move. I really tried to stay not to move.
Right.
If I had to go to the kitchen or to the bathroom, I made it worth my while because I wasn't going to go back.
And this was pre-injection?
That was pre-injection.
Uh-huh. And then you said the week before, like, we don't want our patients taking the anti-inflammatories. You said that was horrible pain, correct?
Right, that's what I was talking about before. When I went off the anti-inflammatories, that's where I felt the really sharp pain. I didn't realize how much pain I was in because I was taking so many anti-inflammatories beforehand. So I went off the anti-inflammatories the Friday before, made it through the weekend, and I was able to take Tylenol. And I was like, I don't know if I could do this after the injection. If it doesn't work, I don't know if I can go 90 days. But after then the injection, and the injection was really a very simple thing. It was less than a flu shot type of deal. It was very comfortable. And wasn't any pain, but still the regular pain was there. So that was a Friday, and then Wednesday I realized that I wasn't in pain most of the day, and then Thursday I wasn't in pain at all, and haven't been in pain since. And so my mobility has changed quite a bit. In fact, I was videotaping myself daily, and then after that Thursday, it's always been good. So I used to go upstairs one step at a time, always dragging that right leg, and now it's like up and down the stairs and walking around, and I don't think twice about going. If I have to go to the car, it doesn't bother me. It's not like a dreadful thing.
Right.
So
well,
mobility has really changed quite a bit. Back in the gym, able to do cardio. I don't handle myself to a certain cardio, which before was something that didn't move my hip or my knee very much. But now I'm just trying to find something larger range.
Yeah, that's awesome. And then pre-injection, the week that you were off all of your medications, where would you rate your hip pain and your knee pain on a 1 to 10? 10 being the worst.
It was over 9, if not 10.
Right.
Especially the hip. The knee, because you have so much pain, you don't notice the hip, one pain over the other. So
sure.
The hip was always the harder pain. So that was like 9, 10.
Right.
The knee was probably right underneath it.
Okay. And then post-injection, 3 months today.
Oh, I don't have one. I filled that sheet out.
Yeah.
1 or 0 or what that, and I don't know that, 1 is just like, that's probably normal being my age and my weight pain,
Right, right. Well, that's fantastic. And one last question. Would you actually recommend this procedure to family and friends?
Oh, I have.
Yes.
I don't know how many people on Facebook have asked me and follow up with me. They constantly are asking.
Right.
Which reminds me, I have to do a little follow-up after today, because I forget about it. I don't even think about it now. So
sure.
The one thing they did ask me was, how long is this going to last? And when I tell them, it's like, well, until I wear it out again, I guess.
Right.
It's the hip, and seeing my back is straightened out. That's why I wore it out. So that's not going to happen.
Right.
So I'll probably wear something else out besides that now.
Yeah. Well, that's very exciting. And the reason I was so excited to do your re-eval after 3 months is, like I told you, and like we talked about, your hip was so bad. And I gave it a 20% success chance, and now you're sitting here today pain-free. I'm just so excited, and thank you.
You weren't the only one.
Yes.
I had 3 other doctors tell me you're not a candidate.
Right.
So, and then you said it's up to you.
Yes.
And I'm not in pain now at all.
Yeah. Well, that's exciting. So thank you so much for sharing your testimony. We appreciate it, and looking forward to you doing better and better.
Yeah, thanks.